Hello, everybody. Thank you for watching this video. My name is Joanna Nava. I am the school specialist for the Imperial County Public Health Department, and I am accompanied by my coworker, Alba Pioquinto. She is the one who handles the outbreaks. I will let her introduce herself.
Hi, everyone. As Joanna said, my name is Alba Pioquinto. I am from the Imperial County Outbreak Management Team, and I just manage all outbreaks in the Imperial County, any communicable disease outbreaks. So you will hear about me or, be in contact with me when you report outbreaks.
Alrighty, thank you very much, Alba, for that introduction. We will be going over the updated guidance for K-12 schools and childcares. So we're going to begin speaking on the updated CDPH guidance for isolation and quarantine. We'll go into a little bit of detail on how this affects students, childcares, as well as employees. And then we'll touch on the Cal OSHA COVID-19 non-emergency standards that have been in effect this year in 2023. It's no longer the emergency temporary standards, now it's the non-emergency one, so we'll see the difference between the two. And then lastly, we'll go over our updated guidance for reporting outbreaks to us here at the local health department. We'll go over what diseases to report, who is required to report and why, and then how to report as well. Starting with the updated COVID-19 isolation and quarantine guidance, the California Department of Public Health has recently updated their requirements on the following topics. First is the guidance on isolation and quarantine for COVID-19. This one is what's going to be causing the most change for K-12 schools, childcares, and employees. And these changes will become effective March 13th. Another change that was updated was the guidance for face coverings, as well as the order of the state public health officer was released. It goes into detail on why these changes were made and what exactly those changes were. And so, as it says here, a few notable changes. The one that will most affect schools and childcares is that there's less emphasis on testing negative when a COVID-19 positive person starts to end their isolation after 5 days. As long as they feel well, symptoms are improving, and are fever-free for 24 hours, they can end their isolation without needing a negative test. And so we'll go into more detail on how exactly that affects employees differently from students and childcares, for example. And then lastly, the guidance for face coverings removed the masking requirement for high-risk settings. This will be effective until April 3rd, 2023 is when that change will happen. So now, starting with the biggest change, the CDPH guidance table 1 is what we'll be going over. Really quick, I did want to walk you through exactly where this table is. And so right here, you can see this was just released March 3rd. This is the guidance for local health jurisdictions on isolation and quarantine for the general public. And then this guidance will take effect on March 13th, 2023. Right here, it gives you the highlights of what exactly the changes are. It removed the recommendation to test in order to leave isolation before day 10 if the individual is well with no symptoms, or symptoms are mild or improving and are fever-free for 24 hours. After ending isolation, persons may remove their masks sooner than day 10 with 2 sequential negative tests 1 day apart. And there was an updated definition of the infectious period to help these both align exactly. And so here it kind of just gives you the overview. And then here we see the first change, the definition for the infectious period. Now it's not just all the way through day 10 someone is considered infectious. It could be through days 5 through 10, depending on when they end their isolation. They are no longer considered to be within their infectious period. And so looking at this table right here, table 1, persons who should isolate. Right here, you can see the change for the ending isolation recommendation. So it says as long as let's say you test positive, that'll be your day 0, or you started with symptoms, that will be your day 0. If you didn't have symptoms, the date of your first positive test will be your day 0 as usual. And then you will do a minimum of 5 days in isolation. And then you can end your isolation after day 5 if symptoms are not present or are mild and improving, and you are fever-free for 24 hours without the use of fever-reducing medication. If you do meet these 2 criteria, then you can end your isolation. And then it says, however, if your fever continues, then you should just wait until 24 hours after it resolves. Or if you keep having symptoms other than fever, continue to isolate until your symptoms improve or until after day 10. And then, of course, if you do have severe symptoms or are at high risk, definitely contact your healthcare provider for available treatment. And then per the CDPH masking guidance, infected persons should wear a well-fitting mask around others for a total of 10 days, especially in indoor settings. And then here's another change. After you have ended isolation, if your symptoms recur or worsen, get tested again, and if positive, restart isolation at day 0. And so here's another new little requirement or recommendation in this case, that if you get out of day of isolation, let's say on day 6, and then the next day, day 7, you do start to have worse symptoms, and then that's when it would be recommended to test again. And then if you do turn out positive, then that will be your day 0 and you would restart your isolation. Of course, we do anticipate getting questions on this point specifically. So again, we'll handle this on a case-by-case basis. If you do have a situation like this at your childcare, at your school, then for sure give us a call and we'll help work our way through it when that does happen. And then really quick, before I go back to the PowerPoint, there is this little note that does make it so that way someone who ends their isolation, has no symptoms, if they want to remove their mask before the full 10 days, they would need to have 2 sequential negative tests at least 1 day apart. If the test results are positive, then you might still be infectious, and it would be recommended to keep wearing your mask and wait at least 1 day before taking another test. And so this is for the general public. And so what should schools follow? What should childcares follow? Going into the K-12 guidance, this is what schools should follow. And specifically for managing students diagnosed with COVID-19, this is where it links to that guidance, the general public guidance, table 1. This will apply to students only, not employees of K-12, because employees fall under Cal OSHA. So we'll be going over a few differences that Cal OSHA requires for employees. But in the case of students, as well as childcares, the childcare guidance has the same link to the guidance for the general public that we just went over, the table 1. Right under children diagnosed with COVID-19 should follow recommendations listed in table 1. This also applies to children of childcares and students at K-12 schools. And so for the most part, for children and students, they can follow this guidance. And then we'll go over in a couple slides how this will affect employees a little bit differently. So moving on, here you can just see the main differences and then that note at the bottom, the biggest change from this update.
So moving on to the Cal OSHA guidance, this is what will be affecting employees that fall under Cal OSHA. So any school employees, any childcare employees will need to make sure they're following this guidance. Before we go into that, there is an upcoming webinar on March 23rd, 2023 at 9 a.m. to 12 p.m. You can find these on the Cal OSHA website under webinars on COVID-19. And then also I very briefly did want to show what the non-emergency regulations looks like. So here is the homepage of the non-emergency regulations. And I'll be focusing on the FAQs here. This was just updated on March 13th. And specifically the section on CDPH isolation and quarantine. And so here we can see the updated tables that are for the most part in alignment with CDPH's guidance. It does allow for employees to end their isolation after day 5 if symptoms are not present or are mild and resolving, and the employee is fever-free for 24 hours without the use of a fever-reducing medication. Then the same, if they do have fever, they need to continue their isolation until 24 hours after the fever resolves. And if an employee's symptoms other than fever are not improving, they may not return to work until their symptoms are resolving or until after day 10. And so it's a little different from what we saw on table 1. For the general public, it says that if you ended isolation, your symptoms recur, worsen, get tested, and if positive, restart isolation at day 0. That is not seen here. So employees would not have to follow that. Instead, as long as it's been 10 days, then you can also return to work. Another difference that we already talked about is the requirement of wearing a face coverings around others for a total of 10 days from the date of, testing positive if you had no symptoms, or from the day you first had symptoms. And then tested positive that day of symptoms would be your onset date. And then for the most part, everything else is the same. Even for close contacts, if you were exposed at work or were exposed anywhere, you should wear a well-fitting mask around others for a total of 10 days. If symptoms develop, test. And then you also, employees still, as before, are required to test 3 to 5 days after last exposure. And so really briefly, I did want to touch on exactly where in the regulations it is necessary. So this is the FAQs, and we must follow this table. But if we want to look at the actual standards here under section 5, part A, section 3. Regardless of vaccination status, previous infection, or lack of symptoms, a COVID-19 case shall wear a face covering in the workplace until 10 days have passed since the date that COVID-19 symptoms began, or if the person did not have COVID-19 symptoms from the date of their first positive COVID-19 test. And so for that reason, it is still a requirement, and employees, again, this note at the end will not apply to them. This is just for the general public. So I recommend that you read the full guidance, the full regulations from Cal OSHA, and then notice the differences between this table that is on their FAQs, and then compare that to the one for the general population to see those exact differences. But again, we are available for any questions.
Alrighty, now for other updates from the COVID-19 prevention non-emergency regulations, these have been in effect starting this year. It used to be the emergency temporary standards, now it's the non-emergency ones. And the difference is the following. It says employers must now report major outbreaks to Cal OSHA. Employers are no longer required to maintain a standalone COVID-19 prevention program. Instead, employers must address COVID-19 as a workplace hazard under the Injury Illness Prevention Program. The COVID-19 prevention regulations do not require employers to pay employees while they are excluded from work. Instead, the regulations require employers to provide employees with information regarding COVID-19 related benefits they may be entitled to under federal, state, or local laws, their employers' leave policies, or leave guaranteed by contract. It says employers must continue to do the following. These have been previously required by the emergency temporary standards and are also included in the non-emergency regulations. It says employers must continue to notify affected employees of COVID-19 cases in the workplace. So sending out those exposure notification letters, letting them know when they were exposed so that way they can get tested 3 to 5 days after that last exposure. You must provide effective COVID-19 hazard prevention training to employees, provide face coverings when required by CDPH, and provide respirators upon request, investigate and respond to COVID-19 cases and certain employees after close contact, make testing available at no cost to employees, including to all employees in the exposed group during an outbreak or a major outbreak. A major outbreak is 20 or more cases within 14 days. And then maintain records of COVID-19 cases and immediately report serious illnesses to Cal OSHA and to the local health department when required. So these are a few updates, but be sure to read the full California COVID-19 prevention non-emergency regulations as well. Now we're going to move over onto outbreak reporting requirements and why K-12 schools and childcares are still required to report outbreaks, because Cal OSHA doesn't require it for regular workplaces, but under California Code of Regulations Title 17, K-12 schools are required to report outbreaks to the local health department. And also under Title 22 California Code of Regulations, childcare center licensees are required to report epidemic outbreaks to their local regional office and to their local health department. So for that reason, anytime there is an outbreak at a school or a childcare center, they should be reported to us here at the health department. So as a recap, AB 685 is no longer in effect as of January 1st, but some of its requirements are still in place from other California regulations, such as Title 17 and Title 22, which continues the requirement for K-12 and childcare centers to report outbreaks to us. And then also the Cal OSHA emergency temporary standards have now been replaced by the non-emergency regulations. So again, still definitely need to notify employees when they've been exposed to COVID-19. You will now have to report major outbreaks to Cal OSHA, and then it will still be the isolation and case management requirements for those days, like for when someone tests positive, they'll still need to isolate, just that now it changed to the minimum of 5 days, and then they can end their isolation, just as how it says in the California Department of Public Health guidance, with just a few exceptions in their guidance that employees cannot remove their mask before the 10 days. But for students and children, they do fall under the full CDPH guidance. They are not under Cal OSHA. Alrighty, so now moving on to what diseases must be reported. The California Code of Regulations, Title 17, Sections 2500, mandate healthcare providers, public or private school directors, and others to report over 85 specific diseases or conditions to the local health department. We will be requiring, again, K-12 and childcares to report only outbreaks to us of some of the most common diseases, such as influenza, scabies, gastrointestinal diseases, COVID-19, and outbreaks of any other disease. For more specific diseases, you can find those under the Title 17 regulations. Again, the definition of an outbreak. It's been the same throughout the past year. For non-residential congregate settings, which schools and childcares fall under, it's still the same of 3 suspected, probable, or confirmed COVID-19 cases within a 14-day period among people who are epidemiologically linked in the setting and are not known to be close contacts of each other in any other case investigation, or for large settings, which would be a school, for example, with over 100 persons present in the setting. It says, especially during high levels of community transmission, much like it was at the beginning, January 2022. Another example of an outbreak would be at least 5% of cases within a 14-day period may be appropriate for defining an outbreak. So let's say you have 5% of your total school employees or students, 5% of those come out positive within a 14-day period. That may be an acceptable outbreak, even without an identifiable epidemiological linkage. And for more guidance, you can follow this link right here. It gives you the outbreak definition through the California Department of Public Health website. So now going into how you will be reporting these outbreaks to us, the same as we have been doing it. The easiest way of doing it is to collect the information you'll need to report to us before actually reporting it. Just so you have all your data that you're going to need to report all in one spot. And then once you do report it to us through our online form, you'll have all the data you need. You just fill it out and you're able to send it to us. And so, of course, basic information such as a contact information for who's reporting the outbreak, where the outbreak happened, what school, what childcare, the address, and then you'll have to provide the name, date of birth, and demographic information for each case that is involved in the outbreak, especially their area that they were located in, the last day of attendance, their symptom onset date, and their test collection date as well. All useful information for us to have and to be able to provide the best guidance for you as your school or childcare is going through an outbreak. And so without further ado, I will pass it on to Alba. She will be demonstrating how exactly to report an outbreak to us through our portal.
Thank you, Joanna. So I'm going to share my screen. Okay. All right, so let's just go over the steps on how to report an outbreak. If you will need to visit our website, which is www.icphd.org, and this is our new website. I know that the schools had an old website. The old website, it's still there with some information for schools and guidelines and questions and videos that you had on the school website. But for reporting outbreaks, we did change the location of the outbreak portal. So just so I can show you, if you click on the COVID-19 orange button right here, it'll take you to the school and childcare administrator resources. This is the website where there's information, guidelines, steps for reporting, and in order to report outbreaks, you will have to go to services, reportable diseases and conditions. And when you click on that, it'll take you to the reportable diseases and conditions website, where you can find also a lot of information about communicable disease reporting. This is where outbreak reporting will stay from now on. So just to let you know, the other website will probably be gone probably in a month or two. I just wanted to let you know. All right, so once you're in this website, you will click on Outbreak Reporting Portal. And then you can read about reportable diseases. This portal will be available for schools, workplaces, correctional facilities, long-term care facilities, hospitals, and shelters. So everyone will be able to report whoever is mandated to report through Title 17 will be able to report communicable diseases through this portal. So step number one, you will want to click on the Confirm Suspected Outbreak Reporting form. And this will take you to our electronic form. Once you are here, you're going to fill out all this information, and let's just do it together. So I'll just write my information. This will be the best contact information. The best contact will be the person that the public health department will reach out to get more information about the exposure. So make sure you do put the person that is that has all the information about the exposure. And also make sure you have the correct email address so we can contact that, the point of contact. And then we go next. After that, it will ask you for the facility information and what type of facility you want to report about. So type of congregate setting, in this case for schools, it will be either K through 12 or we have childcare facility. Either one of those you will select. For this case, we'll just select the K through 12. All right, and then facility name, let's just do example school. You'll write your school name. And then the facility address, let's just go with this. And then the zip code. And please provide us with the code. If you don't know the code, we do have this website that can help you find the code for your facility, the type of facility. But usually for schools, it's the same one for the K through 12 schools. All right, and this is where you're going to let us know what type of communicable disease is being reported. Since we are moving forward of COVID-19, we do want to expand our scope of reporting because under Title 17, we have different types of communicable disease that need to be reported. So here you'll be able to not only report COVID-19, but also report influenza, hand, foot, mouth disease, and other diseases that are reportable. So if you're reporting COVID-19, choose COVID-19, influenza, or other, you can type here also other. So let's say hand, foot, mouth. Hand, foot, mouth disease, and then we go next. For notification of suspect and confirmed cases, you will select what type of group you are reporting. So in the case of a school, you have two types of categories of groups. So you might be just reporting employees, you can choose only employees, or if you're just reporting students, you can just select students. If you're reporting both, you can click on both. You just type in 3. And then any control measures taken. Control measures, there's a lot of control measures for different communicable diseases. If you don't know, just you can leave it blank. But if you do, then you can say, for example, for hand, foot, mouth, cleaning all surfaces, or sent students home, things like that, that measures, control measures that you're taking in your facility because of the outbreak. And then any additional information that you can give us regarding the exposure, that would help us a lot during the investigation of the outbreak. So once you're done with all the form, you can click submit. And then it'll give you thanks. And then it'll say, we have sent an outbreak report form to your email. Please follow up the instructions outlined in this report. So that is all for the electronic reporting form. Just fill that out about the facility and how many cases. And we will send you an automatic email to the best point of contact email. So the email that you entered in the report form, they will receive an Excel form where you will report all the cases. So once that's done, you can close that out. And then this is an example of the email we will send you. And we will attach the reporting form to the best point of contact email. And it'll say school childcare setting reporting form, and it will have an ID number next to it. In this case, ID number 7. We ask that you don't change the name of the file, since we need that ID form for the outbreak investigation follow-up. So this is an example. Once you receive this, you can download that form into your computer and then start filling it out. All right. So this is the example of the reporting form. You can see you will be able to fill out the best point of contact, the phone number, the location name, location type. And I just want to let you know, we do have some tabs here. So wherever it says reporting form, that's the form that you will fill out. And then with all the confirmed and suspected cases, and then send it to us. So let's go forward. Okay. So the top part is the best contact information. We have space for 2 best contacts. If you have more, you can use the additional information box to add more point of contacts. And please fill out the location name, industry type, street, city, zip code, the NAICS code, and then the disease being reported. And then this is where you will put all the confirmed and suspected cases, the last name, date of birth, sex, phone number, address, the category. The category means if it's a staff, employee, volunteer, student, child in the childcare. So just select the appropriate category for the reported case. And then fill out. All these columns are necessary for investigation and finding linkage between the cases. So we do ask that all of the columns will be filled out, please. And we also have a section for notes. If you have notes regarding any specific case, you can write down some notes on that specific case. Once it's all filled out, you save it in your computer, and then you can reply to your confirmation email that we sent originally. You can reply to it. You can attach the form, the completed form. And then once you attach the form, you can just email it back to us and just send it to us, and then you're done. That's it. That's to report a new outbreak. Once you report it, we will receive it, and we will contact the best point of contact if we need more information about the outbreak. Now, moving forward to subsequent cases, any additional cases that you need to report for an active outbreak, you don't need to fill out the electronic form in our website anymore. If you have an active outbreak, you just need to add to the current outbreak form that we sent you with the first cases. So you just add to that Excel form, add the additional cases, and just highlight the new cases yellow, and then email those cases, that form, to that email right there, Epi Outbreak Report, imperial.ca.us. Just send it to us with the new additional cases highlighted in yellow, and that's all you need to do. All right, and that's it. So let's just recap a little bit of how to report. So just gather the information, go to our website, complete the electronic outbreak reporting form, email the outbreak reporting form to us, and then just send it to us, and you're done. That is all. And any questions about it, you can call me. I think my phone number will be in the website. If you have any questions about filling out the outbreak form or anything about outbreaks, you can call me, contact me to my email, my phone number. And then, or you can email the ICPHD Epi Outbreak Report at co.imperial.ca.us, or go to our website if you have any questions. And that is all of reporting outbreaks. I'm going to give it to Joanna now.
Thank you very much, Alba, for that demonstration. As she said, if you have any questions, we are available. You can find her phone number on our website on that form as well. For more general questions, you can call that number and we will get back to you as soon as we can on this 1464 number, or you can email us. We are all on this email and we'll reply as soon as possible. But if you do have an urgent question, you can call Alba regarding outbreaks, or if you have any questions among the guidance aspect, how it affects students or employees or children, you can contact me. This is my phone number, my email, and I will get back to you as soon as possible. Here are some more useful links. You can find more information on the COVID-19 guidance. There is the COVID-19 School Readiness Hub. This is kind of the center for all things guidance regarding schools and childcares. You can find the specific K-12 guidance and, of course, the general public guidance on isolation and quarantine. And then here's some more outbreak information, the requirements, and the different regulations that require K-12 schools and childcares to report outbreaks to us. And of course, if you have any questions, you can email this email regarding that. And so again, I did very briefly want to share our website again. Let me bring it up. So once you log into our website, all things COVID-19 will be here. School and childcare administrator resources. You can find this video. You can find all things that we're currently working on, the links to the guidances. Like we said, you can find the reporting portal here, but again, it's also here under reportable diseases and conditions under services. More videos, COVID-19 testing, and as well, if you want to get vaccinated, there's always this option here. But really briefly, I did want to share the K-12 guidance right here, actually, contact tracing, isolation, and quarantine. We will have our updated decision trees here from ICOE. Our partners at ICOE have developed an interactive decision tree that applies to employees, students, and children. And you can find all the information you would need here as well. Again, this is more for COVID-19. But again, if you have questions on any other types of diseases, you can get in contact with us, as well as using that same form for reporting. And so I want to thank everyone for your time, and I hope you can help us in continuing to keep Imperial County safe and healthy.